share with you today. But I really, standing up here as a representative of Public Health England, and I will tell you about what that agency is and what it tries to do and who it works with, because I think that's vitally important. I really want you to feel really good about the work you do, and I want you to feel encouraged to engage in what I'm going to talk about, which is a very evolving story about the role of farming, the countryside, sustainability, how we produce and supply food to the health of this nation. You are absolutely crucial in that endeavor. And for me, it comes down to three Ps. Not peas the type that we eat or that you sustainably feed to some of the livestock that you care for. But the first P is about place. Place is extremely important. Where people live, where people work, where they engage, where they play. Place is a fundamental aspect of all of our lives. The second thing is purpose. And we know through a lot of the research around well-being that those who live their lives with a sense of meaning and purpose have more fulfilled lives, have more sustainable and intimate relationships, have a greater sense of health and well-being. So purpose is deeply important. And while economic success is absolutely crucial, that is not a mark of the purpose by which people lead and live their lives. It's one means that can set some conditions to make that important. But the concept of purpose is really important. And when I look at the work that you as farmers do and that LEAF does, the purpose that you bring to this enterprise is truly remarkable. And the last P is people. We can't do any of this without people who are inspired, people who are committed, people that sometimes we need to reach out to that we never possibly thought we would be doing that in our lifetime. And that's some of the things that I've been inspired by with the work that you've been doing on Let Nature Feed Your Senses. And all of those things took me immediately back to my childhood. I was thinking about how would I start this morning's conversation with you and try and give a little bit of myself. So I went straight back to my childhood because my biggest engagement with farming was in my childhood. And I was very fortunate to be the son of a psychiatrist and a drama teacher. So I think I grew up in a way that I was able to express my emotions, sometimes dangerously so. But one of the things that my father gave to us was a real sense of purpose. He was one of the original 1960s social psychiatrists. One of his heroes was R.D. Laing. I don't know if any of you may have heard of R.D. Laing. But he was one of his heroes, and his books and his teachings were all around our house. A controversial character, but someone who really believed in the true assets of people who are living and recovering from mental health difficulties. And my father was a superintendent of a hospital way up in the north of Scotland in a place called Elgin. Anybody here heard of Elgin? Anybody here sample some of the amber delights that flow very close to Elgin? And he was a superintendent of a hospital that had a hospital farm. And the reason they had the hospital farm was twofold. One, because it supplied the superintendent and his family with fantastic fruit and vegetables. No, that wasn't the real reason. The real reason was because these communities were ostracized by the rest of society. So they had to be sustainable in the way that they developed and looked after themselves very often. And when I would go to school, I would go to school and I'd come back and I would say to my friends as we were standing at the bottom of the gate of the psychiatric hospital, and I'd say, "Come in." And they'd look at the long, winding road up to the forbidding hospital buildings. And I sensed a hesitation, a reticence to join me up the road. But this was my house. This was where I lived. This was the community that sustained and grew me in my early years. I didn't realize the rest of society viewed them as anything different. But of course they did. And one of the ways that the hospital broke down its boundaries was by having a farm and inviting the community to be active on that farm, but also, very importantly, engaging the patients, those that society had shunned and put in the back wards, to be able to do something with purpose and meaning and a way that they could do something together that would grow and sustain not just their relationships, but their confidence in themselves. And that's really what takes me full circle back to Let Nature Feed Your Senses. It fed the senses and it fed the purpose of the community that I grew up in. And many of the community that I grew up in were there, believe it or not, for long periods of time, but also short periods of time, because they got their confidence back and made their way in the wider world. So it's truly transformative when you can use nature and when you can use farming environments to touch the lives of people. And that's really what I want to try and get across, is that how people think, feel, act, behave, and relate, these are all universal human emotions and human development characteristics. And it doesn't matter if you have a learning difficulty, a psychiatric diagnosis, a mental health problem. All of us need a good sense of mental health and well-being. And that's what I want to try and get across today, and how you can play your part in not just improving the physical health of our nation, but engaging with how people think, feel, behave, and very importantly, relate. Gosh, that was a very long introduction, so apologies. I'm probably already 5-10 minutes into what should only be a 20-minute presentation, so apologies for that. That's helped settle my nerves. So this is what I'm going to share with you. I'm not going to try and bore you too long with the new emerging environment, but it is there to be engaged with, and I'd like to engage you in conversation about how some of you are already doing that and how maybe you'd like to do more of that. You know about the second bullet point, the importance of the countryside to improving health and well-being, so I won't labor that, but I want to get onto some of the issues and challenges and also some of the opportunities. So let's crack on. The slides will be made available afterwards, so please don't, you don't need to take notes or anything. My mother, being a drama teacher, a school teacher, would love you to take notes and put your hands up and sit attentively and with your back straight, but I'm a little bit more relaxed. So let's define health and well-being. Very often when we talk about the words health, we automatically think of the National Health Service, which is great, obviously going through significant challenges as we all are in the public sector, but it is an illness service. Let's make no bones about it. And what we want to get into in Public Health England is a sense of health and well-being that, yes, recognises the importance of health services, but there is so much more to health than the alleviation of illness. So we're very interested in the dynamic space of well-being, how people think, feel, react, behave. That drives a lot of our behaviors, whether it's our lifestyles, whether it's our choices, whether it's the way in which we feel about ourselves and feel empowered to make those difficult moves to moving our lives forward sometimes. This is a lovely diagram, but basically what it tries to show is that health and well-being and its production isn't solely done by the health service or our social care services. It's done by every single aspect of society. And one of the difficult things, and I am very reticent using this word in front of this audience, but one of the things that we do very well in governments is work in silos. Not the kind of silos that you'll probably be more familiar with, but it's very important that we see this notion of health as an embracing aspect of what we can all contribute to. And isn't it frustrating, and I've had some of these conversations with Caroline and her team, that when you're building an enterprise like you're building around farming and its role in health and improving health, how difficult it is somewhere to go to one place that will understand that. You go to DEFRA because you're involved in the environment and farming. You go to the health department because you're involved in health. Isn't there something more universal that can encapsulate some of this? I'm afraid we don't make government easy, it's complex, but you make sense of it. You can make sense of it. This is what we call in the trade a killer slide. Not that it's going to do anything to you, but it's the sort of thing that it just makes you think for a moment that some of the things we've been doing in the production of health maybe aren't as powerful as other things. And what this slide shows, and I'll try and demonstrate that as a public health activist, that I do understand science, which I'm a little bit dodgy on, but there was a meta-review, which means that was a reviews of reviews. So lots of different scientific reviews were brought together in this study. And all this slide shows is that if we want to sustain life and improve health, we should be spending much more of our time concentrating on social relationships. All the other factors, whether it's giving up smoking, whether it's addressing obesity or physical activity, pale into insignificance in terms of the impact that people can have by improving social relationships. I want you to hold that very close, because that's something that Stephen talked about in his introduction, the social nature of what you do, and the social obligation of what you do and the way in which you engage with community and people in communities. Let's do the government speak. So there was a health and social care bill. It created two different agencies as arms of government. We're called executive agencies of the Department of Health. On one side there is Public Health England that takes its remit from the government and is there to help improve the public's health across England. We have three main functions. One is health protection, so flooding, bird flu, outbreaks, influenza, all of that stuff. We have a massive, great big health protection remit across England. We have over 2,000 staff that deal with that. And you maybe often don't see them, but when something happens and they are needed, they are there, and they are world-renowned for their service. The second area is the Chief Knowledge Officer's Directorate, and that is where we crunch and analyze and collect lots of information and data, so we're absolutely on top of how the public's health is, where it's going, what are the trends, how do we future scope, etc. And the third area is the area I work in, which is health improvement. How do we work with local government, the new emerging health system, to get better health for the public? And our connection to local government is absolutely crucial. They now have the statutory responsibility for improving the community's health and well-being. Now, they've got a lot more levers than the health system ever had, if you think about what they control in terms of planning, the environment, how the use of natural space, education, employment. They've got a lot more levers that we can pull. So I would really strongly encourage you to be very engaging with local government, and one of the things that I'll talk about later, health and well-being boards. So let's leave the NHS doing its thing, and let's go into the world of public health and local government. So this is our mission, and we are there to protect and improve health. We do three major things. We basically advise government, and we've been not as quiet as government would have liked us to be about some of the failings of this coalition government to grab the evidence on minimum unit pricing for alcohol and plain packaging for cigarettes. We have been very loud, although you may not know it, in the corridors of Whitehall, complaining that the evidence is there for us to make a stand, but politically the judgment is not yet. So we're saying, if not now, when? And we're gathering a lot of evidence. So we need to talk truth to our policymakers. We need to ensure that we've got arrangements in place for emergency preparedness and health, but we also need to do the thing that I want to talk most about, which is supporting local authorities, clinical commissioning groups, and engaging people like you to produce better health outcomes. Wherever you are, there will be a local Public Health England centre, so if you want to know who your centre directors are, please get in touch with me or with Caroline, and we can make sure that you have more access to what people do. And we publish documents telling people what we're going to do over the next year, and we're doing a 3 to 5 year review, which you'd expect. Let's get on to benefits of countryside and farming in a minute. So when you look at the research, and thanks again to James for giving me some help on this as well, but when you look at the research, one of the amazing things about the engagement of green space, countryside, farms, is the strength of improvement that happens to community indicators. So that sense of things that I was saying together. That sense of community indicators, that sense of knowing place, that sense of being in connection with place, that sense of being connected to others in community. Increases social activity, helps with interaction, builds social cohesion. All of these lovely words are done by some of the things that you currently do and have more ambitions to do. So we're very clear, the take-home message from this slide of this evidence and a whole lot more is the positive associations between engaging with the countryside, with nature, improves both physical and mental health. And this phrase, our Natural Health Service, was coined by Natural England, and they have a very helpful doctor working in Natural England, some of you may know, called William Bird. And they did some amazing studies, and this is phenomenal. So when you're thinking about the social and community value of what you do, then some of these figures, and these economic figures do matter to policymakers. It's not just good enough having something that is altruistic, something that is morally right, to convince hard-nosed policymakers and press civil servants with competing priorities and policies. It's very important to make an economic case. and a little bit more on the evidence. And I want you to think about mental health in 3 ways, and I also want you to think about mental illness. And I want you to think about mental health in 3 very important ways. One is emotional health, how you're currently feeling in terms of your emotions. The second one is your psychological health. How able are you to do the things you wish to do? That sense of affect, that sense of control. And lastly, your social health, your sense of engagement, your sense of social connections, your sense of meaning and purpose. All of those 3 attributes come together to create the kind of mental health or mental well-being that we all need. And then there are those who are challenged by their mental health, some who will have significant distress but may not quite reach the threshold of a psychiatric or mental illness. And there are whole different terminologies around illnesses, whether they are depression, anxiety, schizophrenia, bipolar. I don't want you to be afraid of these labels, because every single one of those labels applies to a person, to an individual that needs everything that everybody else needs: the social, the emotional, the psychological. So I don't want us to think of those with illness over here as others and those without illness as somehow not engaged in the production of good mental health. So I want us to feel that together. But when we look at the way in which mental health is distributed or mental illness is distributed, it's not equally distributed across our country. And one of the things that does give people that sense of purpose and helps create the way that perhaps hasn't really been engaged with as much as you would like to see happen. There are some opportunities. I want to get into some discussion on that. The new public health system does provide them. Please do not think of doctors in white coats or doctors with epidemiological charts. There are lots of people who wish to engage
mentioned, and new applicants can't get it. I farm, take you back to the beginning of your talk, I farm not far from Hoseley Bay, where the prison service used to have a farm, and it was marvellous. The change it brought about for prisoners was fantastic. They have closed the farm. They just have a prison. And I see government going the wrong way, but farmers going the right way. But it would be nice if we were both going in the same direction.
Isn't it amazing how we, and it's only natural that we always look somewhere for some solutions to things. And the interesting thing about the political cycle is it is a cycle. And one of the things that I would say to you is that our agency, hopefully, and your work will outlast political cycles. And I think one of the things to do is that it's absolutely essential that we lobby, that you lobby and you advocate, and Caroline and her team and others will do a lot of that you ask for greater cross-governmental cooperation. Because if we're saying something from a health arena and agriculture and funding for farm stewardship is going in a different direction, we need to have that conversation. And our ministers need to be bold enough to work out of their silos. But the interesting thing is that the demonstration of what you do in other places, whilst other things aren't happening as well as you would like them to, the demonstration of what you're able to show in the things where it is working well, and you're collecting the evidence, you're making the case, it's a lot more difficult for government to avoid that form of evidence. So on the one hand, totally sympathize. There are lots of things happening in the area that I work where we're deeply concerned about how easy it is to cut off the supply line of resources to some things that we think are deeply important. But then somewhere over there's a glimmer of something that is the example of what we want it to be. And I see a lot of that in the work that you do in Leaf. And I am lucky to be preaching to the converted, but I'd love you to put me up in a place where they're not so converted and we could have a more robust conversation. So Caroline, I did ask you who were your critics as part of the discussion and what do they say. And maybe we should have some form of meeting with those that would be more critical of this approach that people here embrace. So thank you for the challenge. We take that.
Thank you, Gregor. And Gregor will be here for the discussion after these three papers, but won't be here this afternoon. So you'll have another chance to go, I think. But if I'd like to show your appreciation for that really fascinating.